I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. I was a published psychotherapy researcher early in my career, and for decades I've taught psychiatry residents, that is, doctors specializing in psychiatry, about psychotherapy. Today I'll talk about the discomfort most people feel when they enter psychotherapy. It's officially called resistance, but I'll explain why that's an unfair and misleading term for it. If you're starting psychotherapy or thinking about starting, you should know that feelings like this are expected, they're usual, and can even be useful. I'll tell you why and how you and your therapist can work with these feelings to your benefit. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. One way of looking at personality is that it's in large part the defense mechanisms or coping skills that we developed in childhood to deal with emotional discomfort. Think about all the different ways people deal with emotional discomfort. Some people laugh it off, others withdraw. Some people gear up for a fight or a competition. Others change the subject or deny that they have any emotional discomfort. Some people distract themselves, or they try to be super rational and ignore the feeling part and just focus on the facts and the data. And others, without a lot of defenses or coping skills, just get overwhelmed. Except for that last group, most of us have some flexibility. We have a variety of ways to deal with emotional discomfort, and it's a kind of gauge of emotional health when you have a collection of different kinds of approaches to coping with emotional discomfort, and not just one or two. So let's say you start psychotherapy with someone that you've never met before, and usually with mixed feelings about revealing painful or embarrassing things about yourself. You want to, that's why you're going to therapy in the first place, but you also don't want to. That's a classic approach avoidance conflict, something that I talk about in a lot more detail in this video here. An approach avoidance conflict where you want to do something, you're drawn to do it, and you're also pushing back from doing it and don't want to do it, that's a setup for anxiety. And anxiety, in turn, is one of those emotional discomforts that brings all of those defense mechanisms and coping skills to bear that I was just talking about. So instead of calmly and directly talking about their problems, most clients do something else. They make jokes, or they withdraw. They gear up for a fight or a competition. They change the subject, or they deny they have any problems. Or they get overwhelmed and can't handle it and flee the therapy. Point is, that's exactly what they do in the rest of life. But it happens that Sigmund Freud, who invented psychoanalysis about 130 years ago, had a special name for defense mechanisms like that when they occur in the therapy. He called them resistance. Or actually, because he didn't speak English, he spoke and wrote in German, he called it Widerstand, which is a German word similar to resistance, but it kind of implies just being in a position opposed to something, not really a conscious decision to be against it. It has a little more of a dynamic and less static quality than our word resistance. In any case, it's kind of an unfortunate name because resistance implies a conscious decision to oppose something. It implies that the client or patient's choosing to oppose the therapy to make it fail. And that's not at all the case. As I was just saying, it's more of a conflict, not a decision, and it's rarely a conscious choice. Instead, it's a natural part of the person's overall personality, the way they deal with emotional discomfort. Since a main aim of therapy, especially the traditional kind of therapy called psychodynamic psychotherapy, the kind I talk about on this channel a lot, since a main aim of that therapy is to look at the person's emotional discomfort, what's really bothering them, what's going on underneath, and how they're dealing with it, resistance isn't really a roadblock. It's information. And as it happens, the very kind of information they're meeting to talk about and to understand. So a big myth or misunderstanding about resistance is that it's something to overcome, something to find a way around or to get over or to break through. And also that it's a bad thing, that it's a problem, that good patients don't have resistance, but bad patients do. And none of that's true. Let me tell you a little story. It's a story that I first learned as a child back in the early Jurassic period. Uh, Here's a neighborhood where I grew up. It's a story of the sun and the wind having a competition about who was stronger. And they decided to have a contest. They would see who can get a man to remove his coat. He was walking by. And the wind went first, and it tried to blow the coat off of the man. And as it blew harder and harder, the man resisted it by holding the coat ever more tightly to himself. And finally, the wind gave up and was unable to blow the coat off of the man. And then it was the sun's turn, and the sun warmed the man up, so much so that he removed the coat himself. The moral of this story, for our purposes, is that a direct assault on defenses, on the person's safety shield, on the coat that they're holding for protection for themselves, just makes them hold on to it more tightly. It makes them raise the defense, not lower it. Historically, tearing away at defenses was something that was tried back in the 1960s and 70s, I think, in encounter groups and other sorts of group experiences where peer pressure and shaming would be brought to bear on a person to try to get them to tear off their defenses and not to rely on them. And I can't say it never worked, but I think that it's pretty well established at this point that that's not the way to deal with a person's ways of protecting themselves. It's just traumatizing. Instead, we have to act like the sun in that children's story. We have to create a situation that's safe enough, that suggests to the person that it's okay for them to lower the defenses themselves. It has to feel like it's their choice, and it also has to feel like it's safe to do. Before that happens, though, we therapists get to see the person in their original state, their natural state, the before picture, the way they currently deal with emotional discomfort. And since one of the principles of psychodynamic psychotherapy is to make the unconscious conscious, we offer defense interpretations at the start of therapy. This is really just a fancy name for bringing it to the patient's attention. I notice you change the subject whenever we talk about your brother. You seem to make jokes every time the topic of work comes up. We talk about your father a lot, but you rarely mention your mother. None of this is aimed to make the client stop or to imply that they're doing the wrong thing. Instead, it's to encourage curiosity. What was going on just then? How were they feeling just before they made the joke or changed the subject or whatever? And most important, what was it that they were avoiding? A good deal of mental energy is tied up in keeping things from ourselves. It's a sort of a compromise that we agree to. We'll participate in a relationship or a job or some other experience, but only by being conscious of part of the experience, the acceptable, less upsetting part. Instead of feeling the full force of shame or anger or sadness or emotional hunger, we live life at less than full strength, a kind of dampened down version that allows us to get along in the world and to get along with ourselves. We can live with this, but not fully live with it. By experiencing resistance in the psychotherapy setting, and by the way, almost everyone experiences resistance in the psychotherapy setting, by becoming conscious of it and maybe appreciating or even honoring what it is that we're trying to do to protect ourselves, our wish to avoid what's underneath. And when this occurs in a setting where it feels safe enough to be vulnerable and to be honest with oneself, then change can occur. We learn that we can tolerate and not be destroyed by our own strong feelings. We can expend less energy keeping things from ourselves. We can compromise less. we don't have to throw away as much of our full experience. And this all starts with resistance, which sounds like a roadblock, but actually it's a doorway. Well, that's it for this time. Was this discussion of resistance in therapy helpful? Please let me know in the comments below. And please like this video, but only if you really like it. Please subscribe if you have not already. And if you have a few more minutes, check out this video for more about psychotherapy and psychologically informed psychiatry. Till next time.